Hey y'all, happy Monday. Just leaving work and I'm trying to finish drinking all of my water here. Have more than 48 ounces and I'm down to I think 30, so I have a lot to go. But I just wanted to come on here because I have a few things to talk to y'all about. I'm officially 5 months pregnant, and yesterday we had our 20/21 week checkup, and we had some really shocking news. First off, the babies are doing phenomenal. They have all of their organs and all of their limbs, and they're both healthy. They are growing and moving around, so they're definitely energetic and engaged. But we found out that we are having one baby girl and one baby boy. So we thought we were having two baby boys, but we're actually having a boy and a girl. So I'm super excited that we get one of each, me and my husband. And that was just, I mean, it was a crazy mix-up. You know, the doctors, the nurses, they apologized. They misread the results. The results did not come to the office like they typically do, so they misread them when they gave them to us a couple of months ago. But however, it's for sure a boy and a girl, and we're just thankful that they're healthy and that they're doing okay. So I just can't wait to meet them. And they're definitely not going to be identical because they're two different genders. So they said that there's no way that they can be identical, but of course they're gonna look alike. So we're just super excited about that. But I have been receiving some packages that we ordered for our stroller and our car seat. So I ordered a Nuna car seat, and I'm going to insert a picture of what it looks like. I'm going to do an unboxing and put it together sometime soon. And then the stroller as well is from Mockingbird, and it's a dual stroller. So it's made for two babies, either like a toddler and a baby or two newborns, and it's super functional. So I can't wait for y'all to see those. We're gonna put it together early just to make sure everything works properly. But yeah, just wanted to come on here and update y'all. I'm feeling pretty good. However, this past weekend, I would say on today is Tuesday. Yeah, so on yesterday, Monday, I started feeling like this intense pain like in my hips. And sorry, my phone is shaking because I have it up here on my tripod. On Monday, I had this pain in my hips that it was like I almost couldn't walk, and it hurt really bad. And I wasn't really doing that much. I cooked on President's Day because we were off on that day, and so we kind of made some barbecue and just relaxed at home. And when I finished eating and I got up, my legs and my hips were hurting so bad. They were so sore, and I went to bed and I prayed about it, and I woke up the next morning and it wasn't hurting anymore. But today at work, today's Tuesday, and I said happy Monday. It's actually happy Tuesday.
I hope you get it together.
I hope you do too.
Oh, girl.
When I went to work today, my hips were kind of sore. So I think the babies are growing. I think it's time now that I get a belly band. I think that's what it's called. So that'll be the next step. But yeah, other than that, I had a migraine. Let's see, today is Tuesday. I had a migraine on Sunday 2 days ago, and it lasted all day. I actually had a migraine yesterday too, but so that has been coming back, but really no nosebleeds. So I'm doing pretty good here. So I'll check in with y'all on the next vlog. Hey y'all, it's like 2:40 in the morning, and I'm at the emergency room. Flashing back to Thursday, I was driving and my nose started to bleed out of nowhere. And I pulled over to get it to stop. It took like 10 minutes for me to get it to stop. And got it to stop. And then I started spitting up blood after that. So went to the emergency room. Had to wait forever to get checked in. And once I got checked in, they asked me some questions. Basically told me it was not abnormal for blood to travel from your nostrils, like down your mouth. And since it was like the first time that happened, to not be alarmed. So they gave me like these nose clips and told me how to like get my nose to stop bleeding quicker. And so they also prescribed me Afrin, a nasal spray, but other than that, they told me to come back if it happens again. So fast forward to Sunday night, I'm in the shower washing my hair, and my nose starts to bleed. And what happens afterwards? I start coughing up blood. When I say coughing up, it's like clumps, like clotted, dark red. So it scared me. So I go to the emergency room again, the same one. Get there, this lady at the front desk. I didn't have to wait long to check in this time. No one was really in there. And she was like, "Oh, we don't have prenatal here. You should go to the hospital where you're going to deliver." And so that was really great advice because I'm getting phenomenal customer service here. They immediately checked me in once I told them my 5 months. They took my vitals, did like a heartbeat Doppler test. Baby's hearts are beating. They did blood tests, chest x-ray, COVID test. So now I'm just waiting to get the results. So y'all pray for me. Keep y'all updated. Good morning, y'all. I just wanted to show y'all my Go Sleek, my little Go Sleek roller, real quick. Y'all saw my hair, how I looked the other night when I was at the hospital. I do have to come back on here to talk to y'all about that, to give y'all an update. But I'm feeling fine today. I'm getting ready to go to work. But my hair was a hot mess. I had already blow dried my hair out. And I just want to see how my curls look. So I'll come back on here later to show y'all. Turns out. So yeah, that did not work on my hair. I'm about to do a ponytail and go. I think the last time I was with y'all, I was in the ER. So I just wanted to kind of give y'all an update. I was actually just looking at a video of these of this couple who was getting ready to have a baby, and the pharmacist basically, you know, didn't really take them seriously and ended up giving them like a wrong prescription. So I just wanted to kind of backtrack and tell y'all about my emergency room experience. So going back to January, I've been having like really bad nosebleeds. And like 2 weeks ago, I guess I had like my allergies really flared up a lot. And so I was having nosebleeds, being stopped up and all that, mucus and all that. And then week before last, whenever I had a nosebleed, I would cough up blood and it would be like clotted. So that scared me so much. And so my husband is out to sea, so you know, I'm here by myself, and I was just really scared, and I went to the emergency room just to make sure everything was okay. So I went to the emergency room, and they kind of like downplayed it, you know, like asking me all these questions about like, you know, what do I do when I have a nosebleed? They kept calling it a nosebleed, and I'm like, no. I have talked to my doctor. I know that nosebleeds are common for, twin pregnancy, but I'm coughing up blood clots, and that is why I'm here. And so anyway, number one, let's just backtrack. When I first got there, I got to the emergency room. I had to wait an hour just to check in. An hour. They had like people lined up and to check in, and it was a nurse and then like the lady, a receptionist. So they were working together, and so you couldn't move up in line until both parties were cleared, and then the next person can go up. So it took me an hour, and there was like this guy there who was literally in severe stomach pain, and he looked like he was in bad shape, and they told him that he had to wait. Like, there was nothing that he could do. So I just thought that was like really crappy. Anyway, so I get, checked in or whatever, and they check my blood pressure. They don't run any tests. The lady basically just prescribed me Afrin, which is like a nasal spray for really severe allergies and sinuses. And she gave me these nose clips to put on my nose whenever I have a nosebleed, and told me like, don't hold your head back, but to put the nose clip here and then like lean forward, and then that's supposed to help the nosebleed stop quicker. So she said the doctor told her that since this was the first time that this had happened, that like, don't be alarmed to come back if it happens again. Okay, that was a Thursday night, right? Sunday night rolls around, having a great Sunday, in the shower, washing my hair. All of a sudden, my nose decides to bleed. And the same thing happens. I'm coughing up blood, and it's clotted, like blood clots. It's a lot. And this has happened like when both times when I did cough it up, it was like more than once, more than twice, like it was coming up bad. And so I was like, okay, well, it was late. I'm like, do I go to the emergency room? Do I not? Like, do I just wait it out and call my doctor? Because I couldn't call my doctor the previous Friday because they were closed. And so I was already planning to call them on that Monday, which was the next day, to let them know what happened and just to see if I need to go, come in to get a check. And so I was like, you know what, let me not wait around. It was a fear of the unknown. I don't want to be in a situation where something is wrong and I didn't do anything about it, and then like I harm my babies. So I went ahead and went back to the same ER. Get checked in. They weren't this busy this time, so I was literally just like the next person in line when I first got there. And then this lady at the desk, she was like asking me like how many weeks I am and all that, if I knew where I was gonna deliver. And she was like, I'm not telling you that I don't want to take care of you, but I highly suggest that you go to the hospital you are going to deliver at, because they have prenatal care there. We don't have any prenatal care. Like, we can't do anything for your babies. We can't check their heartbeats. We can't do anything. I'm like, wow, I was just here and nobody told me that. And I appreciate her. I was like, thank you. I'll just go ahead and drive there because it's literally only like 10-15 minutes away. It literally took me 10 minutes to get there. And so got there. Oh, and the lady had also gave me a heads up that as soon as I told them, because at that time I was 22 weeks. And so she was like, as soon as you tell them that they're going to, like, that you're 5 months pregnant, that they're going to rush you in. And so, and that's exactly what happened. Like, it was so many people there. When I got there, the waiting room was full of people. And this was a trauma center too. So I had never been to that hospital before, but they had, phenomenal customer service as far as like the check-in process. So I checked in. They went ahead, took my vitals, took me back, asked me questions, and the first step they made was to send me back to like the, I don't know if it's ICU, but it's like where the chairs are, and you just sit and then you wait for care to come. And they wanted to check the heartbeats. Now, this is where it gets tricky. So one of the nurses came over. I don't know if she works like in maternity or, whatever the floor is called, but in prenatal care. But she came over there with the Doppler machine, which is the machine that checks the heartbeats of the baby. And I told her, I'm pregnant with twins, blah, blah, blah. And she was like, congratulating me and all that. And she couldn't find a heartbeat. And so come to find out, another nurse came over there and told her she was using the wrong, end. You were supposed to be using a different one. It was supposed to be, flat. And then the nurse is like, okay, you're going to have to help me out and tell me which one is baby A, baby B. And this is a heartbeat machine. It's just audio. It's not anything that, like an ultrasound. And I'm looking at her like, ma'am, I'm not a doctor. I'm not a nurse. I'm not any of those things. I can't tell you which one is which based off of a heartbeat machine. That's your job. And so I told her, what position they're usually in. They're usually, further down in my stomach. That's usually where they are. And so we did find 2 heartbeats. One was higher than the other. That's how I kind of distinguished which one was the boy and which one was the girl. So the boy typically has a higher heartbeat and the girl typically doesn't. So anyway, finally got that done. Then another nurse, or I don't know if she was a nurse. I don't think she was. She came to take my blood to do a blood test. The doctor came to speak to me, and she told me they were going to do a blood test, and based on those results, they may do a CAT scan. And so she does this. Tell me why, when she does the blood, when she takes my blood, she doesn't hold the second part of the needle in her hand. And so the blood literally splatters everywhere, all over my pants. It literally was it was leaking out as soon as she did it. And she was apologizing, and then she wiped it from the chair, but she didn't use no alcohol. She didn't sanitize the chair or nothing. And I'm just like, what the hell? And so anyways, I was like, this is crazy, but I wanted my blood test, so I just wanted to make sure everything's done right. So at that point, they gave me a room, and I was waiting a while. They came back in with the results and told me that that my D-dimer was high, and that they wanted to do a CAT scan, and that had something to do with your indicating that you have a blood clot near your heart or something like that. And so apparently, if you do a CAT scan, it's supposed to tell you if there's something there for real. So I went in there. They wheeled me in there. Oh, I also had an x-ray done as well of my lungs to make sure that there was no blood clot in my lungs, and that was clear. But this was a separate test. So I get wheeled in there, and after the fact, I asked the lady, because the lady kept telling me, the nurse, she was like, I'm gonna have to give you iodine. And it didn't occur to me, because at this point I had been there for hours. I had fallen asleep and everything, and they had already changed shifts, And I asked her after she finished, is this iodine going to harm my babies? And she was like, oh, no, it shouldn't. And I didn't want to ask, but no one told me that you were pregnant. I'm like, why wouldn't they tell her that I was pregnant? What if this is something that could actually harm me? It wasn't on the paperwork. I was like, yes, I'm having twins. When I tell y'all, God be covering me. Why would they not tell you that? That's crazy. And so anyway, long story short, all the tests came back clear. I ended up talking to my doctor the next week, and she told me that since I am having twins, that is pretty much, normal to cough up blood sometimes, because all of the nasal cavity and all of this is all the same area, and so it's connected, and if it sits there, it'll come back out through the mouth. So it's been over a week now. That was last weekend. Well, not this past weekend, but the weekend before that, so 2 weeks ago almost. And that hasn't happened. It only happened 2 times, and I prayed about it, and I'm just glad that everything was okay. But I do have another appointment this month, and I'm going to my doctor is going to check and, you know, make sure everything is still okay as far as like that part about the blood. But I'm going to let her know about like what my experience is like, because she works at the hospital as far as like delivering babies. She has her own practice for prenatal care, but she also works at that hospital too. So I just thought that was crazy, because like I did have to have another needle put in my right arm. So I had 2 needles on each, well, 1 needle on each arm, and it was a different nurse, and the same thing happened. The blood went everywhere, and it was because she wasn't prepared and didn't have the second portion of the needle or whatever, however it connects. I don't know the terminology, I'm not a nurse, but whatever the second portion you're supposed to have in your hand as soon as you put the needle in there, the syringe, she had to wait and unpackage it, and so it went all over the bed. But whatever, I'm just glad everything's okay. Hey y'all, welcome back. Today is Tuesday, March 28th, and I am currently in the car right now. I just left a doctor's appointment, like an impromptu doctor's appointment. A lot has been going on. I'm officially 6 months. I'm 26 weeks today, and I haven't been feeling my babies move. They have been jumping around, moving around like repetitively, and then all of a sudden, like a week and a half ago, I haven't been feeling them. And so last week I actually had a prenatal appointment, and I told the doctor she couldn't find a heartbeat, and so that scared the heck out of me. And so they did an ultrasound and they found the heartbeat. So, but the thing about it is, within like this past week, the movement has decreased significantly to the point where I don't feel any movement at all. Like it's like maybe one kick in the morning, one kick at night, and it's you know, them moving separately. They were moving together like in rhythm. So, you know, this is my first pregnancy. I don't really know what to expect or what's normal, so I just called them this morning to see if I could get a non-stress test scheduled to see, you know, if I should be alarmed or to see what's going on, because I want to make sure they're okay. So anyways, they did a non-stress test. It really wasn't working out. It really isn't as effective with twins. So the nurses were doing that, so my midwife went ahead and just did a ultrasound, and they found the heartbeats. They were in there just wiggling around, and their little hearts were beating really fast, and you know, everything was normal. I just can't feel them because of how my placenta is, how it's positioned. It's in the front, so it's like when they kick, it's like they're kicking a pillow, like a cushion, so I can't feel it. So everything's okay. My nerves are a wreck. I have like really bad sinuses right now. I'm super congested. I know I probably look sick, sound sick, so I just wanted to make sure I documented this, because you know, you may not know that this is something that you may go through. You know, I love being pregnant. I love feeling my babies. My husband came back from out to sea last week, and he was able to feel them for the first time. So it was a really special moment for us. And, you know, this is just, it's really stressful as well, in addition to the beautiful moments. It's super, super stressful because I feel like I'm always worried about them. So I just wanted to come on here and let y'all know that this will probably be the last video of this series. So I'll talk to y'all later. Bye bye.